The Morgan State University Graduate Class Cohort 9 invites you to enjoy our presentation based upon the Essentials of Nursing Informatics, Chapter 17, Trustworthy Systems for Safe and Private Healthcare. Today we will be discussing subjects and materials of private healthcare information that clearly negates the United States Health Information Technology for Economic and Clinical Act, HITECH, Recovery and Reinvestment Act, elements of trust and privacy for healthcare systems, and the HIPAA Act of 2006. Sit back, relax, and enjoy. I'm sure you'll learn something.
Have you seen this? This is a video of that OB doctor who was showing taping and talking about his patients. I mean, you can even see the patient and how she's 35 or something. She looks older, got tattoos.
Wow, she know her butt is too big for all them tats.
I mean, the video even talks about how she's suspected of having hepatitis. This was a doctor for one of her patients.
Oh, I don't know. Goodness. You know what? Let me upload this so I can tweet it.
Yes, tweet that.
You know what? As I think about it, he be telling me about how his patients.
And I heard about him. All right, let me go.
I'm so pissed right now.
Good morning.
How you doing?
Hi.
I have an appointment today.
Who's your appointment with?
Dr. Lewis.
What's your name?
No, okay, ready.
What's your name again?
Last name is Madden.
And what's your first name?
Keisha.
Keisha. Keisha, what's your date of birth?
1/14/74.
Okay. And what are you here for today? Your test results?
My test results? No. I mean, do you usually ask all these questions?
Well, ma'am, I have to verify who you are, so I'm asking questions.
Okay. Well, I'm here for my doctor's appointment, a follow-up appointment, and all the rest of the questions I can answer in the back with my doctor.
Okay, ma'am, calm down. It's going to be okay. I'm going to get you in and out as soon
I'm
as
calm.
I
I mean,
can.
you asking me a lot of questions that I'm not used to hearing at the front desk. I mean, what's your name?
My name is Stacy Johnson. See, here's my name.
Well, you
plate
don't have a
right
name
there.
badge or anything on.
I know, I left my badge, but I wanted to pinch my shirt.
Okay, well, I'm going to go ahead and have a seat. And when he's ready to see me.
Okay, you can have a seat over in the waiting area. Thank you so much.
Thank you. Hello. Hey, can you talk? Girl, you will not believe what just happened. So I'm at the clinic for my OB appointment. And why? I don't know if it was the nurse or tech. I don't know which one she was. And then I guess the receptionist get on the elevator. And they're talking about my OB doctor. That first of all, he shares patient information and was taking pictures or whatever he does. Like, talks openly about all of his patients. And then, the worst part, she has pictures of me on her camera phone. And the reason why I know it's me is because of all the tattoos and talking about I'm here for my test results for hepatitis and all that, which I am, but still, how would she know that? Either the doctor said something or she went into my chart. Either way, she did wrong. Now, I don't even want to see the doctor. I don't want to see anybody here, but I don't even know what to do because he's my OB doctor. I can't go without a doctor. Yes, I'm like, isn't that some kind of invasion of privacy or something? They're not supposed to talk about your personal information. And I'm talking about the receptionist. She's supposed to register people. And when I register, she's asking me about test results and stuff. How does she even know that's what I'm here for? I'm just pissed. I'm just pissed to the nth degree. It's like you can't trust anybody and they claim your information is personal and private. And I just can't trust these people. I don't even want to be saying yo. I just don't even want to be saying. I'm just pissed. They should be ready to call me back in a little bit. I'm ready to sit down, calm my nerves, and I'll call you back. But if I don't have to be here, I'm going to have to come in.
It's only 5 minutes.
I mean, like, everybody has seen my private, and it's on a cell phone. Like, who does that? Let me just calm down. I'm going to call you back.
Keisha, Maddie.
Yeah, they calling my name now. They might as well say everything. They got all my information.
Maddie.
Thank you for waiting.
Jello.
The doctor's ready to see you now.
Okay, so which way do I go today?
Okay, well, today you can go into the office this way and you have a seat right outside of his office and he'll come out.
Thank you.
Hello, ma'am. How are you?
I'm fine.
You appear to be upset. Is there something I can help you with?
I don't know. Who are you?
My name is Miss Kelly. I'm a Joint Commission representative. I work for JCO, and what I do is I come into organizations, acute care settings, and we do environmental care and quality care rounds, and we just kind of help the patients out however we can. And we just make sure your care is quality care. Can you say that today?
I absolutely can say that. My care is not quality care, and I haven't even seen the doctor yet.
How alarming.
Oh, this is just terrible. So you said that you help with quality care?
I do. Mind if I pull a chair up and talk to you?
No, I don't. Yeah, we need to talk. So, like, quality care, would that involve, like, my personal information and stuff?
It is, but fortunately, that should be kept a secret. That's really up to you and your provider to discuss.
Well, that's my point. Like, they were talking about my provider on the elevator. They didn't even know that I'm a patient of his.
Oh.
And that he tells his patient's business and talks about it openly, and that he even
see.
takes pictures. And then I'm on the elevator, and I don't know if she was the nurse or the tech. She had scrubs on. And then the lady that registered me, they have a picture of me. And I know it's a picture of me.
Did you give consent for that picture?
No, I didn't even know they had a picture. It's a picture of me with tattoos that I had.
Well, that
And
surely
they were
isn't
talking
trustworthy
about,
care.
no, it's not. They're talking about how, I'm too old for that and that it's nasty, and that they were going to put it up on some kind of Twitter page for other people to see that. That's just not fair. That's not what I came here for.
You know, fair really isn't even the answer here. It's quality care. It's trustworthy care. It's keeping your protected health information private. Unfortunately, it doesn't sound like that happened here today.
No, it didn't, and it had to start before today because the receptionist was asking me, was I here for test results? Instead of asking me about my name and date of birth, she asked if I'm here for test results for like hepatitis or something. Like, how does she know? I mean, yes, I did have to have that test done because of all of the tattoos and everything. And the pregnancy.
see.
But I don't understand how she knows it. I definitely don't understand how she would get a picture. How was she able to take a picture of me in the exam room where she can see my tattoo?
Well, that certainly should not have happened. And we should be able to trust healthcare providers. There is information that's there, but it should be kept confidential in a need-to-know basis. That's the HIPAA Act.
I mean, well, what are my options? What can I do? I mean, I don't even want to be staying here. I don't trust the doctor.
Oh, how unfortunate.
I just don't trust the doctor. I don't trust the staff. If the doctor's running his mouth or the staff are going through my chart. And I don't want, when I come here, I just want to get quality care. I want to make sure everything's okay with my baby and my pregnancy. I don't think that they should have my information.
Of course. You're absolutely correct.
So, I mean, what can be done? Like, can they be fired or what? I mean, like, my information is out there.
Well, regulatory compliance certainly can have an impact on your outcome here today. And what I'd like to do is give you my card. Can you cut?
get my bag. I'd like to give you my card.
Okay.
And if you need me, please don't hesitate to ask. You're always welcome to call my line. If you have any concerns about your protected health information, about anything that governs your privacy or your security of your records or of your well-being, please use the number. We're here to help.
I mean, thank you. I just can't believe it. I don't want to keep going over and over. But I mean, you just don't know how I feel to be on the elevator and you hear someone talking, other people on the elevator and everything, and then you realize that what they are saying is about you. Like, that's just messed up. I mean, and can they ask all of that information at the front desk in front of other people? I thought it was like a limited amount of information that they should have at the front desk.
Well, again, J-Code really monitors things like that because it's the care environment, the environment in which you receive your care, the environment in which you get protected health information. So yes, there is a law against that, and we take it very seriously. Quality is our care model.
I mean, but what if I don't want to have my health care here?
Well, you
Because
certainly
I
have.
don't. I just distrust this institution.
Yeah, trust is a big issue with healthcare. And unfortunately, this has happened to you today, and I must apologize. But what I'd like to do for you, take my card, please, and call me whenever you're in need. And you take care and enjoy that little bundle of joy, will you?
Thank you. Okay.
Certainly, and feel better. Hello, Miss Nesbitt. Hi, it's Tanya. Yes. Well, no, actually, I'm not finished and I'm not ready to exit, but there's some things I'd like to speak to you about rather urgently. Have a moment.
Sure, come on up.
And where should I meet you?
Oh, the administrative conference room on the second floor is just fine.
Okay, same place as this morning?
Yep.
Okay, I'll see you in like 2 minutes,
Oh,
maybe?
that's great.
Thanks for meeting with me so urgently.
Not a problem. Good job. Here.
Second floor conference room?
Oh, hi, Miss Kelly. It's great to see you
You
again.
again, Miss Nesbitt. Thank you for meeting with me so urgently.
Would you like to have a seat?
Sure, thank you.
Something to drink?
Oh, great, thanks.
That was cute.
So, Miss Kelly, what has prompted this urgent meeting during your survey?
Well, Miss Nesbitt, it's so unfortunate, and I hate to be the one to bring you this news. There was something so unfortunate happened to a patient here today. I was around in the OB clinic walking down the hallway, and a young lady was crying. She was very, very upset. I overheard the conversation, so I have to say there is some validity to her complaint.
That's very disheartening to hear.
Yes. Well, she didn't know who made the complaints, and unfortunately your staff is not wearing their ID badge, which is another incident.
Because they know they should wear their badges at all times.
Yes, and we could really ding you on that one.
Yeah, that would be very unfortunate.
Yes, because to be trustworthy, it'd be great to know if we know who people are when they're taking care of us. And as you know, that's one of our high-tech goals is to make sure that we give trustworthy information. We keep patients' information safe and secure. That hasn't happened today.
And there's no way of knowing who those individuals were?
No, but it brings great risk to your organization, regardless of who it is.
Oh, absolutely. Because, with risk, you got the personal risk and the safety risk. And if they're discussing her information without her knowing, that's a very big risk for the organization. That means bad business.
That's right. And they have photos without her consent.
We need to meet with the patient so we can talk to her, find out who these individuals
Yes. And I gave her my card. I just want to let you know, for the spirit of transparency, I did give her my card, and I let her know that I was with Jaco so that she can call me at any time she had any concerns. So I know and I know that you'll follow up.
Oh, absolutely. Would you mind joining me so we can address this immediately?
Sure, that would be the best approach.
Oh, absolutely. Do you know if the patient's still here?
I don't know for sure, but I know she was at a desk with a secretary standing there. Gosh, I wish I did. It'd be a great opportunity to do education.
Let's go see.
Thanks. After you.
Where am I going?
You said the OB clinic, okay?
Yes, the OB clinic.
Stop quiet. Oh, how do I pause it?
You know, I'm sure you're aware when patients perceive that the environment of care is less than satisfactory and quite violating, there's a substantial amount of risk involved. Mind if I write right away? Sure. Okay, thanks. As well, let's talk a bit about HITECH Act and what that means for your organization. Ms. Nesbitt, it's the intentions of the HITECH Act, the American Recovery and Reinvestment Act, as well as the HIPAA. The healthcare systems focus on trustworthy and private elements of patient care and patient information. You see, it's imperative that efforts are attentive in ensuring patients can trust the security of their protected health information. It's my obligation to alert and report any threats to risk of public safety and breaching privacy concerns. In particular, there are 4 domains that HITECH focuses on and addresses. The first one is EHR, Electronic Health Records. Electronic health records, which you guys are doing a great job with. Patients should feel not reluctant to share their personal information or fear of exploitation of their information. Second, I observe the infrastructure of your computer system and appears it could possibly allow the inaccurate exchange of information and data for several records. I see there was some confusion even with patient data. Secretary certainly didn't recognize any name alerts. It should constitute a red flag for your organization. Next, much of another person's information was disclosed to the wrong patient. Oh my, she was so upset. This is improper accountability for patient's information and qualifies as a HIPAA violation. And last, the thought of staff taking pictures without consent? How disturbing.
It's very disturbing.
This is a big risk to your organization and a distrust of your patients. I am sure that these are not the expectations you have of your staff or the intent to harm the patient who are in your care. I'm confident that you will engage staff in meaningful and useful conversations for future interactions. Let's go. There's the young lady there.
Let's go ahead and go to
Well, hello, we meet again.
It's kind of dark.
Sounding much better.
Hello, my name is Rashida Nesbitt. I'm the CNO of this organization, and I just wanted to come talk to you.
What's the CNO?
That's the chief nursing officer.
Okay.
So the representative came to me with a complaint. I just wanted to hear a little bit more about it and see what happened.
Well, the short of it, she said the nurse was attacked. I don't know which one she was. She had scrubs on. And the receptionist was on the elevator. They were talking about my doctor, the doctor that I'm supposed to see, rather, in that he openly talks about patient information to the other staff in the break rooms and things like that. Like, he was just talking. And they also had pictures of me. And where I have tattoos, they should not have those type pictures. So I don't know if the doctor is sharing that information I told him, if he took the picture and gave it to them, or one of them took it in my exam, or if they went into my record and found it. I just don't know. But I mean, I just don't feel comfortable having my care down here, number one. Then when I register, you know, she asked me all this information. I thought it was limited information that they would ask me at the registration desk. You know, my name and date of birth, maybe verify my address, but she was asking about test results, and I don't even know if she knew if she had the right patient or not. How do I know somebody else wasn't coming? Well, what if it could have been another wrong patient and she's giving my information? You know, and I mean, it's just the exchange of my healthcare information. Like, the doctor telling a receptionist. Come on, what kind of crap is that? And then like, I don't know a whole bunch about HIPAA, but I know at one of my appointments, they said something about my information is guaranteed to be private and that they don't share my information. I mean, the lady at the desk didn't say anything about HIPAA.
Not safeguarded.
But, I mean, I just don't understand how they claim that something called HIPAA will safeguard my information, but yet she come right out the pocket and start talking about all my private information. Like, I don't get it.
Get you to sign that HIPAA form when you first came to the clinic?
No, I didn't sign anything. She was too busy asking me, literally, about
public trust.
why I'm here and if I had hepatitis or if I was getting my hepatitis results.
Lack of individual privacy.
So I didn't sign anything. I mean, I did get upset and I ended our conversation in a sense. I told her I finished my personal information in the bag. So no, I didn't sign anything about what HIPAA.
And you should have, because that way we know that you understand as well as our employees understand about the HIPAA policies and, you know, the sharing of public information with patients. So we're going to go address it with your staff members. I'm sorry to have that encounter, but we'll it's nice to meet you, Ms. Bennett.
Thank you for everything.
Latoya.
Now that's first
Latoya.
class quality.
So now let's go see this receptionist and the tech/nurse we're unsure about. Good evening, ladies. How's it going? Hi.
How are you?
So, were y'all the ones taking care of this lady today?
Yes, I checked on her.
No, because she has some interesting complaints about you.
Two.
Yeah, interesting.
What'd she say?
Where's your badge?
You took my off.
Because you know you're not supposed to be on hospital property without your badge. Because we don't know who you are.
I understand. You're right.
Okay. So I understand it's an interesting video going on when it's phone.
I don't have a phone.
Let me kind of explain HIPAA. Because with HIPAA, you're not supposed to talk about patient information outside of the area that you're working in. And she over here talking about having that.
Not us. I'm always professional.
We probably were talking about it. Yeah. Well, I just want you to know it'll be further investigated and then we'll be discontinued.
I feel bad for that person to be disciplined.
Such a real promise when it found out this. Thanks. Love to see you ladies. We'll both be going to the policy class again.
Remember, quality first. Quality care is at the front of every healthcare organization. We as healthcare providers maintain critical roles in marinating the trust to provide safe, private, and high-quality care to patients. Sound policies, procedures, operations, and technologies are sure ways to safeguard patient data and to mitigate and manage risk and patient safety, individual privacy, and public trust. Please make this a priority in your organization.
Thank you.
Thanks.